Hello my friends, welcome to my YouTube channel. My name is Dr. Syed Kazmi, and in today's lecture I'm going to talk about the public health perspectives of COVID-19. And in this particular video I'm going to focus on the excess deaths. So I'm going to talk about this numbers mania associated around this term known as excess deaths and the hidden lies, what we don't know. So let me start in this way, that since this pandemic began in the early part of 2020, a lot of people, especially the public health specialists, they are honing on a term known as excess deaths, and they're freaking about this thing, and they have used this term excess deaths to enforce lockdowns, not only here in the UK but in many countries of the world. The sad part is that nobody is focusing on the natural biology of the virus. Nobody is focusing on the epidemiological factors which are responsible in the spread of a new virus in the communities or in the populations. Everybody is focused on this number which is known as excess deaths. Now, in order to understand excess death, you need to know what are excess deaths. Now, by definition, excess deaths are the number of deaths over and above the expected death rates for a given population over a given period of time. So if you look into this definition, what it's talking about is that for a given population over a given period of time, you have got something which is known as the expected number of deaths. So you are expecting a number of people to die within that time period in a given population. And if the number of deaths is more than that expected ratio, you will call it excess deaths. And they've been talking about that there will be a lot of excess deaths recently when they are comparing the deaths to the previous time period in the previous years. And they are, everybody's crying about these figures, that they are skyrocketing, and they are using this figure to enforce lockdowns. Now, keep it in mind that when we talk about this expected number of deaths, the way this is calculated is very interesting. What the epidemiologists they do is that they take the last 5 years. So, for example, if you are talking about 2020, the epidemiologists have taken the data for the last 5 years. So, starting from 2015 to 2019, what they are looking is that they calculate the number of deaths in each of these years. So the number of people dying in 2015 added to the number of people dying in 2016 up to 2019. So they will add it up and they would divide it by 5. That is the number of years that you are looking into. And that would give you the expected average deaths. Now, if you look deep into this term, there is a caveat here. Every year, the population rises. So when the population increases, so the death rate also increases. So every year, more people are being born and more people are dying. So you take the average of the 5 years and you calculate an expected value for the current year. While you are not realizing here that for the current year, the population rises, and so the death would also rise. So you cannot use the expected number of deaths for the last 5 years to project something in the current year. Why? Because currently the death rate as well as the birth rate has increased. Let's say the birth rate increases by a factor X and the death rate also increases by a factor Y. So this has to be incorporated. Unfortunately, when we use the term excess death, this is not incorporated because this is taken on the previous 5 years data. So when you use this word, let's say 69 or 70,000 people where we say have died, which is, let's say, excess mortality, you are not taking into account that a particular part of this number would be the natural increase that happens every year. For example, if you take the example of United Kingdom, the population increase, or I would focus on the deaths. So the deaths have risen by a factor of 1.5% every year on average in the last 5 years. So, for example, if you take the average for the last 5 years, you have to incorporate a 1.5% increase. You are expecting that for that average over the last 5 years, there will be 1.5% increase in this current year. So that is already, like, if you don't take into account, and this 1.5% increase is quite natural, you are actually calculating is as part of the excess deaths. While this is quite natural, as the population has increased, so would increase the number of deaths. So that's why this excess deaths is not a very good term to, let's say, put down the number of deaths on a particular cause, like we are doing in case of COVID-19. So then the question is, what is the good figure to depict what is actually happening? World Health Organization uses a term which is known as disability adjusted life years. And disability adjusted life years actually looks not only at the mortality, but also at the potential years of life lost due to premature morbidity and even mortality, and also takes the age discounting into consideration. For example, the average life expectancy in UK here is 79 for males. So if somebody who dies at 78.5 due to COVID, he has just lost 6 months of his life. But somebody who dies due to a road traffic collision at 30 years of age has probably lost 49 years of his life have been gone. So the thing is that disability adjusted life years is a better term to indicate the impact of disease in the population. It's also quite interesting that how the WHO defines a COVID case. If you go on the WHO website, you will see WHO defines a COVID case as a person who has got a PCR positive for COVID-19 irrespective of their symptomatology. That simply means a person who hasn't got any symptoms, is well in himself, but he has got a positive PCR, is counted as a COVID-19 case. Now, if this person dies due to any reason, let's say he dies in a road traffic collision, that death would still be counted as COVID-19 because by definition he was a COVID-19 case. So many deaths in this way have been attributed to COVID-19, which we know were not actually caused by the pathogenesis or the pathological effects by the virus. So that's why what we are seeing is that the numbers are swelling up, while the ground reality is fine. The cases are spreading. Obviously, one reason for the spread of the cases is, like so many people give this explanation that, well, in the second wave there are more number of cases as compared to the first one. Much of it can be attributed to the testing as well. During the first wave, we didn't have that much population testing. Now the population testing has grown to a huge, has grown a lot more. So that's why a lot more people are testing positive. Not all of these are hospitalized. Not all of these are dying. So it simply means that the excess death is not a good figure to say that the disease has got a lot of mortality, because I told you that it does not take into consideration the natural increase in the number of deaths, which would be caused by increase in the population. So again, the bottom line here is that the disability adjusted life years due to COVID-19 is a better indicator, because this is now combining the morbidity as well as the mortality into one figure. It becomes a composite figure. So you're not looking at the population positivity rate and the population death rate separately. You have got both these things combined into one factor, disability adjusted life years. So the public health specialists have to see what are the disability adjusted life years caused by COVID-19, and then you compare it with the disability adjusted life years caused by other, let's say, seasonal diseases or by other public health problems. And then you can set your priorities, what needs, where should the preference be given. So in today's video, what we have covered is that the excess stats is not a good figure to depict the impact of disease. Number 2, disability adjusted life years is a better indicator because it's a composite figure which takes into consideration the morbidity and mortality into one figure and gives you a better picture as far as the public health impacts of disease is concerned. So I hope you have understood the sort of misinformation which can be spread by focusing too much or honing too much on this term which is known as access deaths. If you have liked my videos, do subscribe to my channel, share it with your friends, and if you've got any questions or queries, you can put it down in the comment section below and I will get back to you. Have a good day. Bye-bye.